Good afternoon. I'm Eric Polk, Deputy Director at Georgia Equality. Georgia Equality is a statewide policy and advocacy organization focused on LGBTQ issues and issues impacting communities of people living with and vulnerable to HIV acquisition. Today, I want to talk with you about HIV criminalization, what it is, where it's happening, what's wrong with it, and how do we fight to end it. Also, just some conversations around intersectional advocacy and how HIV criminal laws really impact and work in coordination to harm other marginalized communities such as sex workers and people who inject drugs. We talk a little bit around HIV criminalization and sort of putting a racial justice lens on it and how these HIV criminal laws really impact and are a part of criminal justice efforts that end up leading marginalized communities into mass incarceration. And so we'll start out with just a definition around what HIV criminalization is. So HIV criminalization is the arrest, prosecution, and imprisonment of people living with HIV for things that are perfectly legal or only minor crimes for people who have not tested positive. In other words, HIV status is used as a standalone basis to single out people living with HIV for unique and discriminatory treatment by our criminal legal system. And so let's kind of walk through sort of an overview of the HIV criminal laws. So over 30 states and several US territories have HIV-specific laws. Non-disclosure before consensual sex, so actual transmission usually isn't required under these statutes. Spitting and other modes of exposure to bodily fluids, including saliva, semen, are included in these laws. And what we know about these modes are that they're not modes of transmission for HIV. And there are enhanced penalties for sex work people who inject drugs. There are a number of states that don't have HIV-specific laws that end up criminalizing people living with HIV under the general criminal statute. So in states like Texas, a person living with HIV can be charged for things like attempted murder. And this is without there being any transmission. There are 6 states where there are HIV-specific laws that also include the person registering as a sex offender. And so what the results of these laws is that people living with HIV end up spending years and decades in prison for conduct that's legal or only a minor crime for everyone else. And so this map really just kind of shows us the states where these laws are active, and the states where there are sort of additional penalties where, I talked a little bit about the penalty enhancement. And so one of the things that you can kind of see, I'm here in Atlanta, Georgia. Georgia is a state where people have been criminalized under the general statute, but also under the specific law. And you have states like Florida where there are these sort of penalty enhancements for people who are engaged in sex work and people who inject drugs. And so I always like to talk about this also in context of, states where, or states that didn't expand Medicaid. And so it gets into this larger conversation around, access and how marginalized communities often don't have access. And so let's talk a little bit about the scope and the features of HIV criminal laws. So like I said before, transmission is not required. Any kind of activity viewed as sex and any allegation of non-disclosure is enough for prosecution. So that includes types of sex that we know there is at least a negligible risk of there being transmission. And we'll talk a little bit more about some of that and some later on, but this includes things like oral sex. And so if you're a person living with HIV and engaged in sort of any sexual activity, and haven't disclosed your status, you can be prosecuted. Actual risk of transmission is largely irrelevant. So the use of condoms, a low viral load, activities that have a low risk of transmission, oral sex, spitting, those things are criminalized under the law. Intent to harm is rarely required. So in most criminal laws, there's a mens rea requirement, which is intent, that you have to intentionally seek to do harm. Under these statutes, there's no intent element, which is one of the flaws when we sort of think about traditional criminal law. Proof of disclosure is often the only defense. And what we know about these cases is that because of the heavy stigma around HIV, that in a court of law, the person who's living with HIV is often looked at in a negative light. And so when it's sort of one person's word against the other person's word, the likelihood, because of stigma, because of the miseducation around HIV, the person living with HIV may be viewed more negatively or viewed negatively by a jury. And severe and disproportionate punishments. Another thing in criminal law is that we want punishment to be proportionate to the harm. Like I've said a couple of times, under these statutes, transmission isn't required. And so a person may receive, in Georgia, it's a felony, up to 10 years in prison for non-disclosure, no transmission, not taking into account whether that person had an undetectable viral load, whether condoms were used. They could go to jail for up to 10 years. And so definitely the punishment is disproportionate with the harm here. So we move on to the next slide. What's wrong with HIV criminalization laws? And so I've kind of unpacked a lot of this already. So HIV criminal laws are based on the idea that HIV is highly transmittable, that it's a deadly weapon, and that an HIV diagnosis is equivalent to a death sentence. When in reality, HIV is not an easy disease to transmit. HIV is a manageable chronic condition, not a death sentence that it once maybe was several decades ago. And with today's treatment, a person diagnosed in their 20s can expect to live a nearly normal lifespan like anyone else. And so this next slide just kind of gets into misconceptions about likelihood of transmission, which I think is just sort of really important. You know, these laws don't take into account the science around HIV. And so this chart, I think, is just a good example. Spitting, there is zero likelihood of transmission. Biting, both of these modes are written into criminal statutes. There's no likelihood of transmission through biting. Oral sex, there's a low likelihood, one out of 10,000. Insertive vaginal sex, 4 out of 10,000. Receptive vaginal sex, 8 out of 10,000. And so what we're seeing here is really sort of breaking the myth that HIV is easily transmitted. And so as we're looking to sort of deconstruct these laws, the science is really important in making sure that people really understand what the risk of transmission is. And so what's wrong with HIV criminal laws? And so I kind of have talked a little bit about this as well. And so One is that it disincentivizes people from knowing their HIV status. So if you don't know your status, you can't be criminalized or charged or prosecuted under these laws. These laws continue to promote stigma and push people in the margins. We know that folks who are disproportionately impacted by HIV are in marginalized communities. So we're talking about Black people and other communities of color, LGBTQ communities, sex workers, undocumented immigrants, and other folks. And so, you know, this really impacts populations and folks who are already at heightened risk, who are over-policed, who are over-surveilled. And so those are just some of the things that are really wrong with these laws. You know, when these laws were enacted, the sort of legislative intent was that it would help to reduce new HIV transmissions. And so as we sort of like look at where we are sort of in the HIV epidemic, we know that that's not true, that these laws haven't helped to curtail new transmission rates. And so they don't do what they were proposed to do through the legislative process. And so just another sort of thing to sort of consider as, again, we're looking to change and dismantle these laws. And so the key problems with HIV criminal laws are that, one, I said before, that there's no mens rea requirement, that there's no intent to harm is required. We know that they rely on really inaccurate and stigmatizing characterizations of HIV, about how easily or not easily it is to transmit. And the penalties, the punitive penalties under these laws are extreme and disproportionate. And so those are really kind of the three key issues with these laws. And so I just want to pivot now to really kind of talking about how HIV criminalization sort of intersects with other areas and other spaces around intersectional advocacy. And so some of the spaces where this intersects is around LGBTQ communities, communities of sex workers, people who use and inject drugs, and mass incarceration. And so when I think about HIV criminalization and HIV criminal reform, I'm always looking to bring in allies who are working, you know, on other issue areas that really intersect with HIV criminalization. You know, I see HIV criminalization as a part of the broader criminal justice reform narrative, which disproportionately impacts Black communities and other marginalized communities. And so I just want to unpack that for us just a little bit. And so this map is a good illustration. And so this really shows sort of the intersections around sex work and around communities of people who use and inject drugs. And so this is where this map is showing where there are the penalty enhancements that we kind of talked about at the top of this conversation. And so we know that folks who are living with HIV are criminalized under these laws, but, you know, folks who are, you know, engaged in sex work, or folks who are, who inject or use drugs are kind of double or triply impacted by these laws. And so this map is just an illustration of that. And so let's talk a little bit about how and where this intersects with sex work. And so there may be mandatory testing, which then a person who maybe is arrested for sex work is then charged concurrently with HIV criminalization if their test results come back positive. Like I said before, HIV criminalization and the criminalization of sex work disproportionately harm some of the same communities. So people of color, LGBTQ people, people who inject drugs, and people who are experiencing poverty and housing instability or homelessness. It promotes stigma, and it has negative public health consequences. And so when we think about the intersections around syringe access, you see a lot of those same things. So we know that, again, there are going to be the negative health consequences, that this is going to further promote stigma around these communities. And the same communities that are impacted by HIV, by sex work, and some of these other things are also impacted in the space around syringe access. And so, again, people of color, LGBTQ communities, transgender folks, and individuals who are experiencing poverty and homelessness. And so next, I want to just get into a conversation around sort of the racial disparities in the health and criminal legal system. And so across the spectrum of care, from diagnosis to reaching a sustained viral load, Black communities experience poor outcomes and are less likely to benefit from sustained viral suppression. And so this is just some data that really sort of unpacks this. I know there have been states around the country who have reformed their laws, and the laws have been reformed so that folks who have sustained viral suppression are not charged under HIV criminalization laws. And so what this ends up doing is it ends up leaving certain communities out. And so Black communities where we know that there's going to be more of a challenge to reach a sustained viral suppression end up, being sort of, kind of put in a position where there is this sort of like viral underclass. And so of those folks who are able to achieve viral suppression and those who aren't. And so we want to make sure, as we're thinking about how we reform these laws in states across the country, that we aren't leaving specific communities out of the scenario. And so again, this talks a little bit more just around really the intersections around health and the criminal legal system, and really just unpacking how Black communities are really impacted disproportionately by HIV, disproportionately bear the brunt of within the correctional population, and how that really kind of creates this sort of perfect storm that really needs sort of a racial justice analysis around these HIV criminal laws. So here in Georgia, we partnered with the Williams Institute just to get some additional data around who's impacted in the state by HIV criminalization laws. The Williams Institute has also done reports in Missouri and in Florida and in California to also gather some additional research. And what we found is that these laws, that there are disparities within the enforcement of these laws based on geography, based on race, based on sex worker status. And so what we found here in Georgia is that 62% of the folks who are arrested under the HIV criminal statute are Black people. Once charged, Black men were nearly twice as likely to be convicted of an HIV-related offense as white men. And that sex work offenses were more likely to involve Black women. And again, we're talking about these intersections around all of these like sex worker communities, African American and Black communities, communities of people living with HIV. And so you kind of see who ends up being impacted disproportionately by these laws. And so just to sort of wrap this up, the change that we're looking for is, legislative change. We want to change these laws in states, but we also want to work with prosecutors and folks on the ground to also encourage them to not bring charges under these statutes. Stigma reduction, I think that whatever we can do around reducing the stigma around HIV also helps to inform what this looks like, and helps us to move the needle. And so here are just some things specifically from the vantage point of changing legislation. So as folks are thinking about reforming these laws in their states, you want to create laws where there aren't sentence enhancements and there's no disease-specific criminal law. And so, we're seeing, all the things that are happening with COVID, which kind of intersect with what's been happening for decades around HIV criminal laws. We feel like there needs to be a specific intent to harm requirement that's built into these laws. Steps to reduce risk equal no intent to harm. And so that's things like you would be able to talk about condom usage as a defense, or treatment as prevention as one of the defenses that will come into play. We want to make sure that punishment is proportionate to the harm that's done. I'm sorry, I had a brief lapse there. That we don't want these laws to be felonies. We know that, once you have a felony, it creates a barrier for things like employment, things like housing. And so we don't want folks living with HIV to have to carry the sort of scarlet letter of a felony. And then no new or increased penalties for others. And so this is just sort of a list of things that would be ideal for anyone considering reforming the laws in their state. And so I know this was a little quick, but this is just sort of just a brief snapshot of just HIV criminalization, some of the things that we should be considering in our conversations. And I think that any conversation around ending the HIV epidemic has to include reforming HIV criminal laws. And so here is my contact information, eric@georgiaquality.org. Anyone who wants to have any broader conversations about HIV criminalization, HIV criminalization reform, I welcome that conversation. And so thank you again and enjoy the conference.